Our family had everything packed and ready to go. It was another summer camping weekend, and all of a sudden I heard a loud bang in the bathroom. I ran in there to find my sister convulsing on the floor and bleeding from the head. She suffers from epilepsy and had a seizure. She hit her head as she fell down. That's a moment that will stick with me forever. I had first-hand experience with my sister having epilepsy and seeing what that type of medical condition can do to someone. I also work for government relations and advocacy at Children's Hospital of Wisconsin, and our department is in support of legalizing medical marijuana for children in Wisconsin. That's why today I will inform you about the pros and the cons of medical marijuana use for children, specifically with medical conditions such as epilepsy, cancer, and asthma. To accomplish this, I will tell you about how medical marijuana can be less toxic and produce less severe side effects, while long-term use could cause brain damage and potential cognitive problems in adolescents. I will provide you with information on how marijuana could possibly treat a number of health conditions for children. Nonetheless, the con to treating these health conditions is that there's a lack of evidence and substantial research relating to children benefiting from the use of marijuana for medicinal purposes. Finally, I will provide you with the facts of cannabidiol versus THC and share a success story with you about a case where cannabidiol saved a young girl's life. To begin, I'd like to discuss how medical marijuana can be less toxic and produce less severe side effects, while long-term use can also cause brain damage and potential cognitive problems in adolescents. For those of you that are for medical marijuana for children, you would benefit in knowing that marijuana can be less toxic and produce less severe side effects than many of the drugs that physicians prescribe every day for medical conditions such as epilepsy, cancer, and asthma. Now, my sister was on a medication called Depakote. Depakote is a medication prescribed by doctors to treat various types of seizure disorders. Less serious side effects of this drug include anxiety, agitation, dizziness, blurred vision, hair loss, constipation or diarrhea, restlessness, trouble sleeping, or headache. More severe side effects of this medication include confusion, fevers or chills, unusual bleeding, problems with memory, rapid weight gain, depression, bruising or weakness, and sudden and severe stomach pain. Furthermore, a CNN special with Dr. Gupta, who is a journalist, neurosurgeon, and chief medical correspondent for CNN, says, "Someone dies of an accidental overdose in this country every 19 minutes from taking prescription narcotics such as morphine and oxycodone." When we did our research, we could not find any evidence of death from marijuana overdose. In the Providence Journal 2004, Joycelyn Elder, a former U.S. Surgeon General, said, "The evidence is overwhelming that marijuana can relieve certain types of pain, nausea, vomiting, and other symptoms caused by such illnesses as multiple sclerosis, cancer, and AIDS, or by the harsh drugs sometimes used to treat them. And it can do so with remarkable safety. Indeed, marijuana is less toxic than many of the drugs that physicians prescribe every day. So I'll leave it up to you. Is medical marijuana less toxic and less severe than most prescription drugs prescribed currently?" Now, on the other hand, for those against medical marijuana for children, there is research that long-term use of marijuana can cause damage to the brain's memory. DrugAbuse.gov tells us that marijuana use impairs a person's ability to form new memories and to shift focus. A testimony from Dr. Sharon Levy, a director at the Boston Children's Hospital, said, "Although cannabinoids may have useful therapeutic value, the Institute of Medicine, American Medical Association, and many other professional medical associations oppose the use of smoked marijuana for medicinal purposes because of the physical harms associated with this form of delivery. Use of marijuana during adolescence is associated with cognitive decline as measured by an IQ points drop over time." Now, aside from side effects of medical marijuana, there are other points to consider when debating whether you are for or against medical use of marijuana for children. Although there are a few success cases of marijuana effectively treating a serious illness in pediatric patients, there is a lack of evidence and substantial research directly relating to children benefiting from the use of marijuana for medicinal purposes. For pediatric cancer patients undergoing chemotherapy, using specific ingredients in marijuana can be a successful treatment for severe nausea and vomiting. Also, with epileptic patients, the book Medical Marijuana by Herons and Zott says, for seizures, there is promise that oral cannabidiol is a good treatment alternative when conventional medicine isn't working. Current treatments for seizures can lose effectiveness over time and have serious side effects. CannabisMed.org talks about asthma's relation to medical marijuana. The effects of strains of marijuana closely correspond to those obtained with therapeutic doses of common bronchodilator drugs. Since inhalation of cannabis products may irritate the mucous membranes, oral administration or other alternative delivery systems would be preferable. Very few patients developed bronchoconstriction after inhalation of THC. Now, although there are few success cases, there is no proven medical value to using marijuana. The U.S. Drug Enforcement Administration, DEA, denied the request to reclassify marijuana as a less dangerous drug, while researchers continue to identify beneficial effects. The federal government's position on medical marijuana discourages scientists from doing the required research. In 1988, the DEA administrative judge, Leonard, said, marijuana has no accepted medical use because its chemistry is not known, and adequate studies have not been done on its usefulness or its safety. Dr. Levy said in her testimony against medical marijuana, no cannabinoid product has been studied for safety or efficacy in children or adolescents. The use of cannabidiol, known as CBD, supports the pro side of medical marijuana argument, while tetrahydrocannabidiol, known as THC, supports the con side. There is a piece of legislation currently that relates to medical marijuana in Wisconsin. Representative Call testified in favor of this bill, AB 726, which would allow the use of cannabidiol in Wisconsin. Cannabidiol, also known as CBD, is an oil extract derived from specific marijuana plants that contain high levels of CBD and low levels of THC. Now I want to tell you about a 6-year-old girl. Her name is Charlotte Fege. She's from Colorado. Charlotte suffered from approximately 300 seizures a week. After ingesting cannabidiol, she went 7 days without a seizure. That's amazing. Now, following this story, a mother from Ohio is considering moving to Colorado to treat her daughter's epilepsy with cannabidiol. Now, undoubtedly, there is much more to this subject than knowing the difference in what is in marijuana and what parts of it are beneficial and which are harmful. However, this is all we have time for today. Regarding medical issues, parents just want what's best for their children. Whether medical marijuana is the answer or not, I think we could all agree it's an option at least. There are several pros and cons to this very controversial decision, and I've informed you all on just a few pros and cons regarding the use of medical marijuana for children with medical conditions such as epilepsy, cancer, and asthma. I'm sure you have all begun to form an opinion on this topic, and I want to assure you that no matter which side you support, the end goal for everyone is to help children with illnesses. While lacking in research, medical marijuana for pediatric patients under a physician's care could be an effective treatment for several diseases and medical conditions. Dr. Gupta says it's irresponsible for the medical community not to have it as an option, but the bottom line still exists that there is a lack of evidence that this is the solution. Put yourself in the position of those families with children suffering from painful diseases or medical conditions, and you will understand that if your child were suffering and an ingredient in marijuana could help, I'm sure you would want to use it. Arguably so, there is not enough research to date to prove that it will save a child's life. Thank you for your attention today.